I'm going to pass the podium over to a patient speaker, because even though we have experts, sometimes where we find our inspiration is in the words of somebody who's been there and done that. Andrew Weller has a very unique patient story, and one that I think fits very nicely with tonight's topic of understanding your pathology. So Andrew, can I call you up to the front?
Well, thank you everybody for coming today, and as Deb said, I'm Andrew Weller, and I've been under surveillance for 30 years now. So, no, not by guys in black suits and dark sunglasses, but as a guinea pig for the guys walking around in the white smocks, so like Michelle's wearing tonight, but she's not one of the doctors that is hunting me down all the time. So, no, I have multiple bilateral cysts so basically I have lots of cysts on both my kidneys. And so my doctors and I have been monitoring the growth of these cysts for basically the last 10-15 years with this set of doctors. And so I'm a mathematically inclined engineer by background, so I've actually extrapolated the data, so I know exactly when the doctors need to have a cure for my kidney diseases and my kidney cancer. So right now I'm tracking, and I haven't yet, but I sort of know when I'm going to hit that 8-centimeter trigger where they start to want to do surgery. You'll probably find out a little bit of that later today. So yeah, I'm under surveillance, which you'll find out later tonight. There's drug therapies, there's surgeries, or one of their standard procedures is just actually surveillance to see how you're progressing, because the radical surgeries or what have you may not be appropriate until you're at a certain stage, like myself, and as I said, 30 years surveillance. So how it all started with my family is, in 1972, my father was diagnosed with kidney cancer, and he had a radical nephrectomy, which he lost one of his kidneys. Happy to say, though, that my dad is still very healthy. He's lived since then with one kidney. He plays golf 3 times a week. He's a snowbird, so he's quite active in his community down in Florida and also in Toronto. So no problems there. However, after my dad had his surgery, the year later, I had another aunt. She lost a kidney, and then 2 years later, she lost her second kidney, and several years after that, after being on dialysis for a number of years, she actually got a donor kidney, and she lived many, many years after that quite successfully and healthful. The year after my aunt's first operation, I had another uncle that lost a kidney to kidney cancer. So going back into the early 70s, basically the only option was radical nephrectomies. Now there's a lot of other techniques. So when the third of 8 siblings ended up with kidney cancer, the doctors started trying to compare notes and see, well, hey, something's going on here. So we got part of a study at St. Mike's, and a doctor picked us up. And so I like to say I'm a bit guinea pig and a bit vampire, because as we get into these clinical studies, you'll see what happens. But so we first got part of a study at St. Mike's, and they were doing ultrasounds every year. However, that wasn't picking up everything, and they were monitoring our family, trying to figure out, okay, 3 siblings and everybody else, what's going on here. And then around that same time, there was a study from the NIH, which is the National Institutes of Health in Bethesda, Maryland, just outside of Washington, D.C., which is a big, huge medical center. They do a lot of world-renowned research. Anyways, they started a study on kidney cancers, which later became the Van Hippel-Lindau syndrome study. At the time, it was unnamed. And they picked up our family, and we started being screened and processed as part of that study. However, very quickly, the doctors realized that we didn't fit the mold. We didn't have all the other symptoms of what became VHL. So they shelved our family. They took us out of that study, and basically, as I said, they shelved us for a number of years. What ended up happening is Dr. Jabbar and his team down in the NIH, they found the VHL gene. So they had succeeded in that, and then so they thought, okay, well, what about these other families that didn't quite fit the mold, but still have what looks like hereditary kidney cancers because it's multiple family members. So they pulled us off the shelf, and they decided to do some studies on our family. So, as I said, my dad had 3 siblings, but there's actually 8 of them in their family. At that time there was 8 brothers and sisters, and I'm one of 27 cousins. So instead of taking 40 plus of us down to Washington to study us, Dr. Jabbar decided he would come to Toronto, and it was around October time frame, so my mom said, okay, we'll have a Thanksgiving party at the house. And she enticed all my relatives over with her famous cabbage rolls. What we didn't tell everybody up front was that if you were a blood relative, you got to go directly to the kitchen, and your cost of admission was a vial of blood. So, anyways, if you weren't a blood relative, you were sent to the basement, you got to grab your first drink and listen to everybody yelling and screaming and fainting upstairs. So this was prior to 9/11, so you can imagine the next day we took Dr. Jabbar from the NIH with his 2 coolers filled with blood and a box of syringes. We took him to the airport, and fortunately at that time nobody cared at security that you had a doctor with syringes and blood in his arms, and you can't send blood in the cargo, so he had them as excess carry-on that we had to get him special permission. It was kind of a funny situation at the airports. Anyways, 40 plus of us had our blood taken that day, and I guess with that many family members, most of them with the same last names, something happened down at the NIH and the bloods got all mixed up. So now it's a month and a bit later, so again my mom's thinking, okay, it's now Christmas, we're going to have a big Christmas party. So what's Dr. Jabbar get for Christmas? 40 vials of blood. So everybody comes over again, we all show up in the kitchen and we all get our blood taken. Everybody else that's not they get free drinks down in the basement, and we have a big huge Christmas party. And again, Jabbar goes back to Washington with all his blood and syringes and what have you. So how many people can you say have bloodletting parties with all their family members, which is really bloodletting? Anyways, it turned out very fruitful for our family and for the study of kidney cancer, but 7 years after that, they did find the gene that's responsible for my family's hereditary kidney cancer. And so now we're still under surveillance. We do know the gene, and people can be now screened for it. However, with all that studies, we go down every year and they still monitor us and see how things are progressing. Some of my cousins have had more advanced kidney cancers than I have, so they've actually been on other clinical trials, which is being new surgeries, so laparoscopic surgery, the sparing. So as I said, with my dad, my uncle, my aunts, 5 out of the 8 kids have now had kidneys removed, so there's actually less kidneys in my dad's generation than people. And you're supposed to have 2, as most of everybody here would know. So anyways, my family was also part of different surgeries, which is now the sparing technique and laparoscopic and that. So it's quite interesting. Deb sort of mentioned beforehand, she was sitting in a waiting room across the street and met Tony Clark, who founded KCC with Deb. Well, we go down there and it's funny, you start seeing all these people and you just start talking about your personal, intimate health reasons that you're down there for. So you're comparing lesions, you're comparing tumor sizes, you're comparing whatever other symptoms you have. And so you start building up that network of people. And so what happened was my cousin was down there at one point and happened to be sitting beside Deb, and they got talking about intimate kidney issues and what have you.
Not intimate.
Yeah, but so when my cousin came back home, we're quite open within our family. We all know our personal medical histories, more so than just the kidneys, because as you can tell, our family's quite a large family and we got a lot of issues that way. So my cousin told me about KCC and Deb, and at the time I wanted to do some volunteering. So I contacted Deb and I said, hi, I'm available and I'd like to volunteer, and what can I do to help you? And timing's everything, as they say. So Deb showed the website in the preview, and I do sourcing, and she needed to source a new website design firm and hosting firm. So I sourced the website for them, got that up and running. Actually, Catherine did all the hard work, but I just found the company and helped negotiate the contract. But since then, I've been asked to volunteer on a survivorship plan, which is going to be talked about, I think, a bit later on today, too. And then, as about a month ago, I went to the AGM, and they actually decided to elect me onto their board. So now I'm more involved. So yeah, so my situation's slightly different, but I'm on the hereditary side, so for all intents and purposes, healthy and just under surveillance. The doctors keep monitoring me, and as I said, I sort of know that year where it's going to become more critical. However, there's also new drugs coming on the market, and the doctors down at the NIH, they're very confident that they'll have a cure for at least our particular disease before they all retire. At least that's their goal. They've spent their careers on us. Just like the doctors here at Princess Margaret, the General, all these hospitals in BC, there's a lot, I think you said there's 19 advisors on our board. So yeah, there's a lot of great research going on across Canada, around the world, and hopefully there'll be cures for most of this eventually, and that's what we're all working towards. As I mentioned, Deb mentioned the website. I worked on the website. I encourage you all to go on. Deb actually alluded also to the interactive map. It's a great support system for you guys. You can go in. It won't show your exact address, but it'll show you generally where you live, so that other patients, other caregivers, you can form that little local support group to help each other out when times are difficult and what have you, or even when times are good. And also we have a couple other events on there. We alluded to Kick Butt for Kidney Cancer. We're having a 4-hour aerobic boot camp in end of June. And there's also a lot of other opportunities to volunteer and get involved. So, and we're all a community here now that we can help each other and work together and find a solution and a cure for kidney cancer. So with that,
Thank you, Andrew. That was inspiring, and we are lucky to have you both as a volunteer, a board member, and a kidney patient who tells a story of great hope and contribution to the research that's happening.